Hello, my name is David Ruiz. I am a junior who was lucky enough to obtain a scholarship through the Allied Health Academy at Cal State Fullerton. My internship was with a group called the COPE Health Solutions. The program in which I am still interning is called COPE Health Scholars. I work for the Citrus Valley Health Partners, which consist of Queen of the Valley Hospital in West Covina, Intercommunity Hospital located in Covina, and Foothill Presbyterian located in Glendora. The preceptor for my internship's name was Rachel Paneker, who is the program director of the COPE Health Scholars and has a master's in public health from Dartmouth University. The COPE Health Scholars, which used to be called the Clinical Care Extender Program, or CCE, was started by UCLA medical alumni for students to gain hands-on experience in healthcare. My objective of this internship was to gain experience by eventually shadowing a physical therapist. This was in order to gain volunteer or hands-on experience in order to be considered a quality applicant for graduate school. This was very important to me because my only experience prior to this was as a restaurant manager. I had no experience in the healthcare field. I was having trouble obtaining an internship that provided hands-on patient experience. Most volunteer positions I did have an opportunity to do were doing paperwork or minimal office tasks. The Allied Health Academy granted me a stipend to complete this 4-month internship with an ongoing record of my experience and efforts to help me gain entrance into graduate school once I obtained my bachelor's degree in health science from Cal State Fullerton. I was interested in many aspects in the healthcare field, and this opportunity gave me a chance to explore the different areas of patient care. My internship started with a 3-day, 33-hour training on patient care and common hospital jargon. Once I completed the training, I took a final exam consisting of 100 questions and a practicum demonstrating the different patient care techniques I had learned. Once I was done with training and tests, I was assigned to a nursing floor shadowing registered nurses on the orthopedic surgery floor at the Queen of the Valley Hospital. I chose orthopedic surgery because as a student that hopes to gain experience and exposure to the physical therapy field, I could get a first-hand look at the patient's recovery from surgeries and eventually make their way to physical therapy, occupational therapy, speech therapy, and the rehabilitation floor within the Queen of the Valley Hospital. Some of my tasks and responsibilities including taking patients' vital signs, helping feeding, helping bathing, changing patients, assisting them from the bed to a gurney, or discharging patients, ambulating patients, which is basically after a surgical procedure. Patients need to get up and get out of bed and start moving around as soon as possible. So as a health scholar, your responsibility is basically to assist them while they walk around the hospital, just basically getting the blood moving and getting use of their limbs. I also would sit with patients during chemotherapy procedures just as moral support, just basically interacting with the patients, just sitting there, talking to them about their life, their family, just stuff like that. I can think of one experience where I came in one week and I met this nice lady, and she was complaining about her foot. It was turning a different color, and I came in the next week, and unfortunately they had to amputate her leg, and her morale was very, very low after that experience. And I just sat there and I just spoke with her, and this gave me a chance to tune my bedside manner, because patient interaction is everything. And I myself was a patient at one point, and I understand that when you're going through something like that, if you don't relate to the person that's caring for you, it's hard for you to trust them. So it gave me that experience to connect with people in in kind of like a devastated state, and just seeing a smile on their face, being able to bring them a card, or get them a cup of coffee or something like that. It definitely helped tune my skills for what I come to expect in the future in the healthcare industry. Once I completed my rotation on the orthopedic surgery floor, I was recommended by the RNs I was working with to my department coordinator, and I was lucky enough to be able to choose the floor which I would rotate to next. My choices were the gastrointestinal lab, the dietitian's floor, the definitive observation unit, infection control, outpatient therapy. There's the lab, where they do all the blood work and they work with the microbiologists on all the patients' testing. But the one I chose was the acute rehabilitation center. The acute rehabilitation center is where they work with all the occupational therapists, physical therapists, speech therapists, for a short amount of time, basically gaining the patient's independence back so that they can function on their own. So in the acute rehabilitation center, I worked with physical, occupational, and speech therapists. The team helps the patient basically gain independence from traumatic injuries, strokes, hip replacements, knee replacements, and back surgeries. Just stuff that requires a lot more attention than simple outpatient procedures such as like rotator cuff injuries or simple muscle strains and whatnot that require physical therapy. Some of the tasks working with physical therapists are gait coordination training, step training, working on the parallel bars, basically gaining control back because when you undergo some of these injuries that you lose you get nerve damage, you lose function of certain body parts, and you have to be taught basically how to reuse those body parts and those limbs properly again. Especially some of the stroke patients, because a stroke, it's a blockage in the brain which cuts off, blood supply to certain areas, which if it hits the right spot in the brain, can basically paralyze individuals. So I would assist occupational therapists, and I would help groom patients. I would help bathe patients, help them dress, help them eat. Hand control exercises. I would help, like brushing their teeth. But the whole point of the unit is to allow the patients to do as much on their own as possible, because eventually that's what they're going to have to do once they go home. So, just working with them on those things hand in hand gave me some great experiences, just learning, compassion for patients, patience, when dealing with the recovering individuals. And basically just, it kind of solidified my interest in the physical therapy and therapy world, or, to pursue my career further in the physical therapy realm. Through the 4 months that I worked for the Queen of the Valley Hospital and still continue to work, I built some great connections with nurses, therapists, and hospital staff. And, at the end of the summer, I was lucky enough to be asked to become a department coordinator myself for the Health Scholar program. Basically, a department coordinator helps train the new interns. I write the schedules. I introduce them to the rotation that they're going to be heading to once their prior rotation is done. And I was lucky enough to get the position. So now I am the department coordinator at the Queen of the Valley Hospital for the operating room and the gastrointestinal lab. So, it's just a great experience. Some of these interns, they're allowed to go in and actually observe live surgeries, which is an opportunity that most volunteer positions never get the opportunity to just sit there and view, open heart surgery or brain surgery or, gallbladder surgery or whatever the surgery may be. It's a great experience, and it can really help you basically, figure out whether or not you are built for the profession that you're going to school for. So pretty exciting. And best thing I've learned from this entire experience is no matter what obstacles I face, I have the ability to achieve the goals I set out for myself. If a patient can learn everything from scratch and I'm perfectly healthy, I can become whatever profession I choose. This also solidified my interest in physical therapy. Like I said before, this is not the most lucrative health profession, but the gratification you gain in helping a normal person function again is, to me, it's worth every moment. And even in the 2 months I was in the rehabilitation unit and still continue to be, patients tell me how thankful they are to me and how nice I am, and they think I'm a full-time staff member, which, I'm not. I'm just a volunteer. But at the same time, it just makes me feel good. And it makes me feel like, this whole experience of coming back to school, um, working with the Allied Health Academy, gaining this internship, and, being granted this stipend was well worth it. And, first and foremost, I'd like to thank Aaron for the opportunity, Chad. Um, I'd like to thank, Lily Espinoza and all the people who work for the Allied Health Academy, because, this experience has taught me so much. And, I won't forget it. If you guys have the opportunity to apply for, the stipend or the internship, whether it be, the internship or the research project, I would highly recommend it, because it could open up doors that you never know. I mean, if nothing else, it can help you, figure out whether or not you're built for the profession that you're actually going to school for. And, it kind of lit a bigger spark underneath me to, continue doing what I'm doing. And I feel like I'm on the right path. It's just been a great experience, and I've been fortunate enough to be able to log it, my entire experience on my website. I have a WordPress website. I also was able to build a e-portfolio on LinkedIn, as well as the Portfolium websites. So, if you have a chance, you can visit those and see, some of the encounters a little bit more intimately. Some of the patient interactions, just some of the experiences I've gained from it. This whole experience has been really, really great. And like I said, I'm very, very thankful to the Allied Health Academy. And if you guys ever see me on campus, feel free to come up and ask me about my experience. You can ask me about the Health Scholar program. Allied Health Academy basically helped me, and now I'm the Allied Health Chair for the Student Health Professions Association as well, which is an experience that without the Allied Health Academy, I wouldn't be in this position. It's very important to be able to gain letters of recommendation and just show some type of involvement, so that you're not just going to school and getting good grades. It's actually diving into the profession in which that you're trying to pursue. And I know grad schools look at that type of experience, and I'm just very thankful for the opportunity in which I've been given. And hope you guys enjoyed this, and hope you enjoyed my experience, because I know I have. And like I said, if you ever see me on campus, you're more than welcome to come up and pick my brain, ask me some advice. I'd be more than happy to help you out with that, whether it be in Student Health Professions Association, Allied Health Academy, or even the Health Scholar program. I have the ability to help people gain entrance into that, and get the experience, hopefully, that I did. So you guys take care.